Why do tonic-clonic seizures occur? Imagine a sudden electrical storm inside the brain that causes chaos in how your nerves communicate. That's essentially what happens during a tonic-clonic seizure. These seizures happen because of a rapid, uncontrolled burst of electrical activity in the brain. Normally, nerve cells send controlled signals to each other using electrical and chemical messages. But during a tonic-clonic seizure, this control is lost. Many nerve cells fire at the same time and very rapidly, creating a hypersynchronous electrical storm. This abnormal firing starts in one part of the brain and quickly spreads across both halves of the brain. It involves different brain areas like the cortex, subcortical regions, and even the brainstem. This widespread activity explains the intense muscle stiffening, called the tonic phase, followed by rhythmic jerking movements, known as the clonic phase. It also causes a person to lose consciousness temporarily. Scientists believe that the trigger for this electrical storm isn't always clear. However, several factors can increase the risk. Some people have genetic mutations that make their brain cells more excitable, leading to inherited epilepsy syndromes. Structural issues like brain injuries, tumors, or congenital malformations can also disrupt normal brain circuits and cause seizures. Infections such as encephalitis or meningitis can inflame brain tissue, making seizures more likely. Metabolic imbalances like low blood sugar, sodium, calcium, or magnesium can destabilize nerve activity. Sudden withdrawal from alcohol or certain drugs can also trigger seizures. Additionally, lifestyle factors like sleep deprivation, drug use, or heavy drinking can increase the risk. At the cellular level, seizures involve a phenomenon called a paroxysmal depolarizing shift. This is a prolonged depolarization of the nerve cell membrane that causes repetitive firing of action potentials. This process is driven by ion channel dysfunction, especially involving calcium and sodium ions entering the cell. It's also influenced by the failure of inhibitory mechanisms, which normally help keep nerve activity in check through neurotransmitters like gamma-aminobutyric acid. When these systems are disrupted, neurons become hyperexcitable and prone to firing in bursts. Tonic-clonic seizures can happen as isolated events or as part of ongoing epilepsy. When they recur, it suggests that the brain has an underlying predisposition to seizures, whether from genetic factors, structural brain changes, or metabolic issues. These seizures are often dramatic and frightening because they come on suddenly, involve a loss of awareness, and can lead to injuries if the person falls or hits something during the event. Understanding why these seizures happen helps doctors develop treatment plans. Medications aim to control abnormal electrical activity and reduce seizure frequency. Addressing underlying causes, when possible, can also help prevent future episodes. Remember, each person's experience with seizures can be different, so personalized medical care is essential. If you or someone you know experiences a tonic-clonic seizure, seeking medical advice is crucial for proper diagnosis and management.